I get to do one of my absolute favorite things today, and that is have a guest at my podcast studio in my house, literally in the basement of my house in Dallas, Texas. So I told Dr. Shiroko Sokitch, who is one of my dear friends, she's staying with
Yay.
me, and I'm like, come to my basement. Okay, that's a little creepy. So, and we're going to talk about trauma. And if you've been triggered by going into anyone's basement, then you will completely resonate with this message. But today I am really thrilled. Dr. Shiroko Sokitch has been, we've known each other for what, a decade at least.
I think 12 years.
Yeah. A long time. And, and her gifting is, well, number one, like you talk about the therapeutic relationship between a physician, a doctor patient. She creates a safe space and you can feel that therapeutic relationship. She also has a very unique story from going through surgery rotations, right? So being a residency as a surgeon, and then to really completely deviate into TCM, so traditional Chinese medicine, and Ayurvedic and acupuncture. And so I'm really thrilled to bring my dear friend and wise woman here today with you. So welcome, Shiroko.
Oh, thank you for
Did I
having me.
traumatize you bringing you into my basement?
Well, that's funny because I do have basement issues, but this basement seems pretty finished. So, or I had basement issues in the past. So, yeah.
So one of the things that I want you to share a little bit of your journey into why you brought a lot of Eastern medicine into your practice, but also we want to talk about how the body holds on to trauma.
Okay. So you want the whole story, or people in your audience have heard my story a little bit, right? So
definitely in my programs, because we have a special episode in Magic Menopause with you for sure, and that is like an incredible, priceless episode. It's amazing. It's amazing because that's the things, like we put our heads together and we figured, okay, like the incorporation, Eastern, Western, really getting to the root causes of disease in our energetic body, which will manifest in our physical body, and how to bring those pieces, how we brought those pieces together. Powerful.
Yeah. So I'll just start from surgery. I was a general surgery resident in Seattle when I finished medical school. And I was real interested in surgery because the first time I got to save a life was when I had a patient that came into the ER in my third year of medical school, and he had multiple gunshot wounds, and one of them was in his heart. And I got to go to the operating room, and we literally saved his life in a moment of, finding the right place. So surgery became like my interest at that time. And then when I was in residency, I kept encountering patients who had, much more complicated problems and who were in really a lot of pain. And I'm an enemy of pain. And especially when I was working on the burn unit, I had these patients that had just terrible pain that wasn't managed by medication. And somebody gave me a book at some point during my second year of residency that was called The Web That Has No Weaver. And it was about Chinese medicine. And it talked about how energy moves in your body and how the view of Chinese medicine, and it made so much sense to me. And, when I read the book, I was just like totally in love. And it's been now almost 40 years since I read that book, and I still feel that way about Chinese medicine. And it's because how energy moves in your body and how it works, and the system of Chinese medicine explains it all. And it makes sense in a way that people can use for themselves, for their health, and also for so many different things. And in particular, of course, physical pain, because it can help eliminate pain in just moments, So, and then we were asking about trauma, and with trauma, for one thing, surgery can be a trauma, and the things that I loved in medicine were the traumatic events. People who came into the ER, I practiced emergency medicine for 10 years, and the people who came into the ER with sudden, traumatic events. And so I think I've always kind of been interested in helping people with trauma. And and Chinese medicine I've created a set of tools to help people with physical trauma in Chinese medicine. So, yeah.
Well, and we want to talk about that today. And I
Yeah.
think the most important aspect is that bridge, right? We
Yeah.
talked about this last night over ribs in Dallas, Texas. So but like that bridge from where you are now to where you want to be, crossing that bridge as the healing journey
Yeah.
to healing
Yeah.
from surgery or trauma or traumatic existence.
Yeah.
And this is a piece that it's so powerful. So first, we'll get there, but I want to talk about the concepts of acupuncture, because you use acupuncture so much in your practice, and especially for pain. Well, talk to us about how you're using it and the science behind acupuncture.
Sure. Oh, whoa. Lots of
Right.
things to cover. So the basic idea in Chinese medicine and using acupuncture is that you're made up of energy, and energy travels through your body in certain patterns. And when your energy's out of balance, there are problems. And everything's based on your internal organs. So there's a pathway of energy on the surface of your body for each of your internal organs. And so, for example, the lungs start in your physical lungs, but the pathway of energy goes down the front of your arm down to your thumb. And then the large intestine, which is paired with the lungs, starts on your index finger and goes up the back of your arm to here and up into your shoulder and across to your nose. And so your whole body is covered by pathways that are corresponding to your internal organs. And how the internal organs work is different than Western medicine. So there's many additional functions. For example, the lungs are connected to your physical lungs, your entire respiratory system, starting in your nose, your throat, your physical lungs. And then it's connected to your large intestine, your skin, the ability to protect yourself from things that come in from outside, which means your immune system. And your lungs are your outermost energy layer. And so, and like the whole thing about energy and the science of Chinese medicine is so incredibly detailed and in depth. And so when people talk about energy, to me, the foundations of Chinese medicine help us understand how energy works in our bodies on a level that's way beyond what we already, like you could go so deep into it because it involves emotions and spiritual functions, because the emotional function of the lungs is grief. And the spiritual function is to stay in your body. And every organ has an emotional and a spiritual function in addition to, and, all the physical functions that we talked about. So, it's a complete system of medicine. And then if you add that to Western medicine, which is what I do, then you have this spectrum of ability to help people. It's huge, So there's Western medicine, there's Chinese medicine, and then I use functional medicine in the middle to kind of overlap both of those. And it's all designed to help a person find the root cause of what's going on, which often includes emotional or spiritual things, which is how we get back to trauma.
Yeah. Exactly. And think the lungs hold the energy of grief.
Yeah.
And also, like, as you described that, it's layers of energy. It's not just one energy.
Yeah.
There are layers of energy, right?
Yeah.
Spectrums of energy, fields of energy. And health and vitality is a wide, vibrant energy field, right?
Yeah,
and
exactly.
Illness is not. So one of the things I learned as I traveled around the world from different philosophers, from a Native American shaman to an Andean philosopher to an Indonesian medicine man, was this consistent messages that the lungs hold the energy of grief, the breast relationships, the liver anger, the pancreas guilt, the kidneys fear. And it goes beyond that, but that was so consistent. It made me pause as a Western trained physician to think, okay, well, wait, there's this, there is this consistent traditional 1,000 years old wisdom. How do we now incorporate that? How did I first incorporate it into my life? And how do we incorporate it into helping our patients recover. And trauma is stored in the body. Trauma can be the memory of trauma, let's say, the memory, not as opposed to the trauma itself, right? The memory of that trauma, the feelings, emotions of that trauma are what gets stored. And then in working with the spectrum of Eastern and Western medicine that you do, please help us cross that bridge, release that trauma.
Okay.
You can, yeah.
Yeah. So
feel free to use me as a guinea pig, Shiroko. This is bring out your needles. No, I know you are.
So first of all, so many different things can be traumas. So any kind of event, like we were talking about being scared of basements. I didn't know so many people were scared of basements. But my grandma locked me up in the basement when I was little, in an unfinished, dark little basement. And I was terrified of dark, unfinished basements for years after that, and wouldn't go into caves and things like that. But fortunately, I've healed that. So, but you can have events that occur that might stay in your body and then cause physical problems going forward. I'll give you a few stories, but I'll tell you first how I created a system of 7 acupuncture treatments for clearing the emotional and spiritual traumas from your cellular memory, because so many people hold traumas that they can talk about in their bodies. And I'll tell you a couple stories. So I have a patient, or had a patient, who came to me a number of years ago, who was having really bad perimenopausal bleeding, and she was bleeding like for weeks at a time and being anemic. And she didn't have big fibroids, but she did have some fibroids. And when she came to me, she was hoping to not have a hysterectomy, and but didn't understand the emotional trauma that was behind it. And in her storytelling on an initial visit, she told me that her son had died a year before in Iraq. And so when that was like, for me, big red bells. And so I said to her, I think you have PTSD, and I have a series of acupuncture treatments for that. And she looked at me like I was crazy. But I gave her that first treatment that day, the first one. And then she didn't make it a follow-up appointment, but I called her a few days later and I asked her how she was doing and how she had received that information. And she told me that the bleeding had stopped after that first treatment. And she had one more recurrence of bleeding, but then her periods became normal again. And not only that, but at the time that she came to me, she was working in a grocery store doing a menial job. And by the end of the 7 treatments, she had changed her career and started blossoming again. She started dating after she had not dated. Like her whole life came back online after she was able to clear that trauma from her body. And then
you think the uterus, because the womb, the mother energy, that affected the uterus.
Yeah, of course. Yeah. Yeah. And then I had another young woman who was in a car with her dad when they had an accident that killed him. She was in her teens when that happened, and she had a headache pretty much continuously every day since then. And it was 10 years after the accident that I saw her. And I did the same treatments for her. And the first few treatments, the headaches didn't go away. And again, for her, not only did the headaches go away, but her whole life changed. Like, she was able to start expressing the things that were important to her. Because when her dad died with her in the car, I think it changed something in her that was, she was unable to move forward. And after the series of treatments, she was able to start changing her life and moving forward. So being able to clear traumas, you may not even be like, you may have done a lot of different work and it may have been years ago, because I have patients who talk to me about things that happened 50 years ago or things that happened last week. So it's different for every person, but we hold on to emotional and physical experiences in our bodies. And so using something like acupuncture to help shift that energy out of our cells can be so healing.
So how do we like cross that bridge? And I will say personally, from what I learned through these other healers as well, in my practice years ago, I had a nurse who came in and she had been having recurrent pancreatitis, and she'd been on antibiotics, been hospitalized, and had done all these things. And I remember, okay, so when we can't get an answer in medicine, right? That's when we go beyond, right? We go looking. And I remembered what the ancient healers had told me, that the pancreas holds the energy of guilt. And I sat with her and I said, is there something you feel guilty about? And she just started crying. She just started bawling her eyes out, crying, and nodded her head, and just sat with her for a while. And literally when she came back for her follow-up, she's like, she felt she had addressed those issues of guilt, had been in the practice of forgiveness, worked in the practice of forgiveness, which we talked about. Like that is so for us. Forgiveness is so for us, like forgiving ourselves too. And she never had another recurrence of pancreatitis. She just felt like a shift in her energy. It was incredible.
Oh, wow.
So like for me as a physician, I think, okay, well, prophylactic antibiotics, what were those things? And then that thought had, I was reminded of the pancreas holding the energy of guilt. And this was the organ that it was showing up in again and again and again. And I think about this too, with my patients with breast cancer, where there are issues with relationship, unrequited love, trauma. We think of the breast hold the energy of relationships. What was that when we have disease show up in a certain part of our body? Understanding the energy of that body is helpful. And then, so we want to clear that. We want to do this practice and clear that. What is that? How do we cross that bridge?
Well, so I think you're referring to what we were talking about last night. So I'll talk about that. So one of the things I help people with is making surgery an extremely successful event. And I'm working on a book about sailing through surgery. And one of the things that I teach people is, and this comes from when I was an undergrad student, but so whenever you have surgery or a traumatic event in your life, you are suddenly catapulted into a new place. And lots of people talk about this in different ways, but basically, if you're having surgery, before the surgery, you're in this place. And after the surgery, depending on what the operation is, it could be something small like eye surgery, or it could be something huge like a knee replacement or a hip replacement,
or a hysterectomy or mastectomy.
But you're physically and energetically, you're in one position, and then within hours, you're in a very different place physically and energetically. And that one can prepare for that by imagining themselves here and imagining that procedure before it happens, and then imagining that procedure or that event took them to a new place, and seeing themselves on the other side completely well and feeling great. And I've done this with hundreds of my patients, helping them. Like I always try to keep people from having to have surgery, but if they're going to have surgery, let's make it the most amazing, successful experience that takes them to a new place.
And so when you say like envisioning that new place, like, so I had done my breast explant surgery and like thinking of, okay, what could I have done ahead of time? And we think of these pre-surgical, post-surgical guides that were all about supplements and stuff. We're not talking about, okay, what's the end experience that you are in? And and often we go into surgery without ever thinking about that. Like for me with the explant surgery, I knew because I've done, I'm a gynecologist. I've done a lot of breast exams on people who have had explants, and there was that uncertainty. What amount of breast tissue would be left? What would the scars look like? Like, where does that leave me, post explant surgery with this change, this transformation in my body? And I really pre-op, I never really thought about that. I mean, a little bit like, it will be what it's going to be. But how would you recommend, like, in retrospect?
So
In
once it's
retrospect.
happened and you haven't thought about it, well, you can still take yourself through that process.
Okay.
So you can just take, okay, so now you've had a surgery, let's say, and maybe it was a great experience, or maybe it wasn't the best experience, whatever that experience was, but you can still take yourself and say, okay, here's where I was and here's where I am now, and I want to be here. And I want to transform my experience. And so you can still do the same thing. And if you so breast surgery, like you said, is relationship related, right? So you start thinking about, okay, what am I thinking about relationships? What do I want to experience in my relationships? And how do I want to be in that setting? So then you see yourself here where you are now after the surgery. So we're talking about after surgery now. And then imagine yourself in a vibrant, loving, healthy, amazing relationship, and keep imagining it. So they say that for something to become embedded in your being, you need to practice it for 90 days, or is it, I think it's 90 days. It's like the gong practice, right? So 3 months of every day imagining yourself in a new place as a result of having had that procedure. So depending on the organ, so let's say you had pancreas surgery, same thing. You can imagine yourself guilt-free and healed completely and digesting your food properly and having normal blood sugars, all the things that are connected to pancreatic function. See yourself healed.
Yeah.
And just keep seeing yourself healed. And if you have scarring, so any place you have physical scarring, massage that area and give it a lot of love, because, in my book, The Healing When It Seems Impossible, I always talk about love as the most powerful healing force. And it's the first chapter, and it's about loving your body, loving the cells that you have, and giving them as much support and healing as you can. And I just feel like my ex-husband used to tease me because I was always massaging myself. I was always
Positive
rubbing
touch.
my skin and always massaging myself. And he used to laugh at that. But, honestly, it helps your skin be healthy. It helps you be younger. It helps you feel good. Like I massage my face every day. I haven't done anything to my face, no injections, no nothings. And I think that it just helps to pour a lot of love into your whole body. So if you don't have the chance pre-operatively to do the imagining yourself completely healthy, you can still do it post-operatively and then work on the scar tissue. And of course, there's things like laser and red light therapy that will also help. Acupuncture helps remove blockage. If you have pain after a surgery and you have scarring, the acupuncture removes the scarring blockage. And massaging yourself, wherever the scars are, and pour a lot of love into them.
Mm-hmm.
We talk about using certain oils to help the scars be less dense. You can do that. There's also a therapy called neural therapy. Are you familiar with that? Where you inject a scar with lidocaine
Or procaine,
or
and
procaine.
then post the injection with those.
Yeah.
Can do that too.
Yeah.
And even around periumbilical, if you've had a C-section above the bladder with bladder issues, because it can be from the strictures in the fascia.
Mm-hmm.
Say the Goldilocks organ of our body is the fascia, and I think acupuncture works at the fascial level.
Yeah.
And so there's so much traditional wisdom. I would say, one of the things is that the trauma, the emotional trauma held into a body. If that someone is listening and they say, Dr. Ann, I just really can't see myself well. I can't see myself well because all these things have happened to me. Every time I lift myself up, something else really terrible happens. How do you address that situation, that person who's listening here today and she's saying, I just can't see myself. I'm afraid to hope because I've just been hit down, again and again and again.
Well, first of all, I refer you to my book.
Yes. And please tell everyone where to get your book.
My book is on Amazon, and it's Healing When It Seems Impossible, 7 Keys to Defy the Odds. And it talks about all those things, like the emotions, the physical, the spiritual, the physical elements.
I have it here somewhere. Right there.
And I was going to bring it, but I left it at home. so, but so there's several elements to my book. One is love. And that is really starting to look at what does love mean to you? Because we think about love in relation to other human beings or our pets or things like that, but we don't think about love in relation to our bodies. And so if you have a body thing or many body things, the first thing is to start looking at your body with love. And we talked about this too yesterday. Yeah. We've had a lot of conversations in one day.
Yeah, we have. It's the theme for my online groups too, in Magic Menopause, especially in Girlfriend Doctor Club, has been, you can, and I wrote about this, you cannot heal a body you hate.
Yeah.
You cannot heal a body you hate.
Yeah. And so many women are taught not to love their bodies because we're given this negative image about how we look and how we're built and so many things. And, so first start with love. And I make it simple in the sense that, okay, let's say you can't love yourself. Love something else, because love is this amazing magical energy that you can love something else and really pour love into that. Let's say the only thing you have is a dog or a pet or a plant even, like let's say there's not another human being that you can connect to. Start to pour love into that plant. Just doing that will start to bring love back to you. It's like a boomerang. It's like if you purposely put love somewhere, like consciously and purposely, then you can start and it'll start to come back to you. But then the other thing you can do is find one place in your body that you don't hate. Maybe it's just your hands. I love my hands because they do so much work. But let's say you find one place in your body that you find is okay in this time of where everything feels terrible. Love that. And pour your energy into that. And then slowly it'll start to expand into other places. And then the next thing is to think of yourself as a hero in your own journey. And like, as
explain that.
So some of my favorite movies are all those hero movies where, they don't know anything and they're miserable and they're lost and nobody likes them and they're rejected in every way. And then they find something and they start to be like, I'm going to keep going. And the elements of a hero are, one, to never give up, because there's always something that you can do, even if it's a tiny little thing. Like, let's say it's taking one supplement a day that helps you feel a little teeny bit better. You can just start to do some small thing that starts to make you feel a teeny little bit better. And the changes that I'm talking about, you don't have to do big things, because trying to do big things sometimes is so overwhelming when you're in a place that's not feeling good that it feels like you can't go anywhere. So if you keep having bad experiences, just do one little tiny thing. And then step by step, start doing better. And, a lot of times when you're on a journey to get well, you may feel initially a little bit better or even a lot better. But I've experienced this hundreds of times with my patients where they start to feel better and then suddenly they have they fall backward. And it feels like everything they didn't work. And I've heard this so many times. They start to feel better and then they go back and they're not feeling better. And it goes on for a little while. But if you keep going, even when it feels worse for a little while, then it'll eventually correct and suddenly you're better. I don't know how much time we have, but I want to tell the story of my eyes.
Please, you have time.
Okay.
Yeah.
So I have always had double vision in my life, and I had it when I was so young that I didn't know that it was double vision until I got a lot older. And I had one eye that looked down and the other eye seemed to look straight. And I spent years going to acupuncturists and chiropractors and neurologist chiropractors and eye doctors. And I even had LASIK surgery because I had poor vision. And I thought that the double vision was caused by my astigmatism, but when they corrected my vision, I still had double vision. I was like, what's wrong? And then as I got older, my ability to compensate got less, and my left eye visibly drooped down so that it looked like, I thought, scary. Um, and all of my life, I held my head tilted to the left so that I wouldn't see double. And nobody diagnosed it. All the eye doctors I saw, all the optometrists, ophthalmologists, people who gave me eye exercises, nobody figured out what was wrong. And finally, I got to a point where I couldn't walk downstairs unless I closed one eye, because somebody had told me to get a prism to help correct the levels. And the prisms actually made it worse. And I couldn't look at my computer unless I closed one eye. In medical school, I couldn't ever look at a microscope because my two eyes didn't match up. And so I just used one eye to look in a microscope. But finally, I said, okay, I can't take this anymore. I'm going to have to find somebody. So I went looking for a pediatric ophthalmologist because they do that kind of surgery. And I found a guy, and the minute he walked into the room, he saw that he said the muscle in my right eye was paralyzed and that my left eye was compensating, and that was the problem and that he could fix it. I was like, oh my God. And so I had one surgery on both eyes, moving the muscles to help eliminate the double vision. And it didn't come. He told me that it might not be enough in the first operation to completely correct it, that I might need a second operation. And I waited a year and I had a second operation, and I have no double vision anymore.
Like after 60 years.
After 60 years.
Amazing.
Yeah. And so one of the things is, of course, that 60 years of my brain being a certain way, like the brain had to adjust to that. And so all the things that I'm talking about, my brain is like I never had a problem. I have no double vision. I'm able to hold my head up straight. My balance is better. I don't bump into people when I walk. I don't fall down. I can have both eyes open when I look at my computer or walk down the stairs. So big changes. But it was years of trying to find answers. And I know many of you also have had years of trying to find the answers, or maybe seen 7, 8, 9 doctors trying to get answers. I'm just saying, don't give up. And then the last element of that is recognizing that our bodies are just as much our school as our lives. So like we always think about other people as being our school, and that we have to learn from experiences that we have. But we also learn from our bodies, and we learn from the experiences in our bodies. So if you hate your body, then the experiences are going to be hateful. But if you are willing to love and recognize your body as your friend, then you can start to learn what you need to learn from these experiences.
That's powerful.
Yeah.
Thank you, Shiroko.
Of course. Yeah.
Thank you. Well, there is so much to this, right? Understanding that, it is one next right step at a time, right? To never give up. Start loving one part of ourselves, initially at a time, feeding love into that, reminding, and that helps us remember. Maybe it's that, like you said, the plant, the picture, the pet, the experiencing what that love feels like, and leaning into that, because it's there, it's around us. And sometimes it's so hard to see because we're in this dark place.
Yeah.
But having that faith, and again, visualizing, okay, I love it, across the bridge. If I've crossed this bridge, what my vision of myself is, what I look like, what I feel like, how the transformation is there. And that visualization of that brings that reality closer and closer.
Yeah.
And the concept never to give up. So how can people find you and connect with you, Shiroko?
Well, my website is hearttoheartmedicalcenter.com, and it's because my love to your love. And heart to heart is where healing begins, right? And you can find everything there. My blogs, my newsletters. You can sign up for my newsletter there. My book is, you can link to my book on Amazon through my website. So that's your best place to find me. Yeah.
And you're in practice, what part of the world?
In Northern California, Santa Rosa, California. But I do remote work if some people want that, although I can't do acupuncture from far away.
So that is like, we're going to get to that next.
Yeah.
We're going to get to that next.
Yeah.
You guys, thank you for being here. This is an important episode. It is that reawakening of the synergy between our body, Eastern, Western medicine. I mean, healing exists in a whole without prejudice, right? Without bias. And it's true to our experience of that healing journey. And, you know, you've been in my community long enough to hear me say just one next right step at a time. So take something from this episode and incorporate it into your daily practices, that one next right step at a time. What is your one next right step? And how can you take that with love for yourself and love for your future self? That's how we get there.
Yeah.
And share this episode far and wide. Check out Dr. Shiroko Sokitch at hearttoheartmedicalcenter.com, right? hearttoheartmedicalcenter.com. If you're in the Santa Rosa area, definitely visit her in person. She's like a miracle worker, y'all. She's incredible. So thank you all for being here. Please, again, share and subscribe and let me know. I want to hear your comments. What have you taken? What's your next right step from the information you have gained from this episode? Thank you guys for being here. Until next time, God bless.
Thank you for having me.
Very welcome. And I'm so excited. There's so much more. All right. You got the needles?
I do. Yeah.
All right. Go for it.